Hi everybody, in this short video, Dr. Peter and I want to give you, we're each going to give you our 2 favorite exercises to help stretch and strengthen your lower back. Many of you found our office because you were suffering with lower back pain, and these exercises are definitely going to help you. You've probably already received a handout with some generic exercises that we've given you, but even if you're not somebody who's been suffering with lower back pain, these exercises are great to get in the habit of doing to help prevent lower back pain and to help strengthen your lower back. So again, the first kind of exercise that we're going to be giving you is an exercise that will be aimed at focusing your spinal flexibility to get things moving better. And the next exercise that each of us are going to give you will be focused on strengthening your lower back and stabilizing your core so that you're going to be less likely to injure your lower back when you're doing your day-to-day activities. So the first thing you're going to want to do is you're going to want to find a surface that you can do your exercises on. And a carpeted surface with a nice underpad is perfectly acceptable. If you have hard surfaces in your home and you're looking to get an exercise mat, we would recommend that. In the office here, we have different mats that are available for sale. If you don't have one, I know it's kind of tricky to get exercise equipment with the lockdown right now. So what Dr. Peter is going to start by doing is he is going to show us first his favorite stretching exercise. And let's begin with that, Dr. Peter, and I'll just have you explain it, please.
All right, so what you're going to do is you're going to lay down the mat here, okay? You're going to have your left leg straight. I'm going to be stretching my right side for now, okay? You're going to bring your knee up, and you're going to aim to go towards the same side of your shoulder here, okay? And this is a great stretch for your low back and the low back muscles. So you can hold that stretch there anywhere from 30 seconds to 2 minutes, okay? Then you can also bring it across and stretch, bring it towards the opposite shoulder, now my left shoulder. And just start incorporating some of your glute and hip muscles. So you have tight hip muscles, this is a great way of focusing stretch on that. And then you can even bring it all the way across and have your arm on the opposite side. And this continues to stretch all across the low back there. Again, holding this for 30 seconds to 2 minutes.
Okay, so when you do those stretches, Dr. Peter, you said you're holding them 30 seconds to 2 minutes.
Yes.
Are you just doing them? Are you doing each one of those positions once or twice, or how often?
I would do them anywhere from 2 to 3 times. The tighter a muscle is, the more often you should do it, and you can do it periodically through the day, in the morning, at lunch, and in the evening.
Okay, so it's okay to do them more than 1 time a day. Is it possible to stretch too much?
I wouldn't say it's possible to stretch too much, right? I mean, you're very tight. Obviously, you do it more often. It's just going to help release those muscles and get the best out of your adjustment as well.
Okay. So would you say that it's accurate to say you can't stretch? You might be able to stretch too hard, but you can't stretch too much.
Yeah,
is that accurate?
Yeah, that would be a fair statement. Definitely.
Okay, that's awesome. That's really helpful. So what would you recommend to somebody? That's a great one for increasing flexibility. What would you recommend for somebody who wants to start to strengthen their lower back? A simple movement they can do.
All right, so my favorite one, sometimes it's called bird dog, sometimes it's called Superman's. You basically want to go on all hands and knees, okay? Basically like a tabletop. You want 90 degrees here, 90 degrees at your hip, right? And to make it easier, you actually want to widen your knees and your hands and give yourself a wide base of stance as opposed to being really close together, okay? And what you're going to do is you're going to lift one arm and the opposite leg so you're flat, okay? So you don't want to hyperextend, you want to come so you're completely flat, and you want your head in a neutral position looking straight down. So again, you're not like this and you're not like this. Looking straight ahead, come here, and then come back down and touch, and come back up slowly, okay? Everything's in a slow, controlled movement, all right? And you want to do this anywhere from 10 to 20 times, and then you're going to switch to the opposite side after doing that. 10 to 20 times, and then you can do that again up to 3 sets on each side.
So when you do that again, just go back into that position again, Dr. Peter, and let's just see you do that again. So you'll notice that he's kind of pointing his toe when he does that, so you're kind of stretching the body apart. Where do you feel the contraction when you're doing
So
that?
you're going to feel it on the upper back on my left side if I'm doing the left arm here, and then the lower back on the right side.
And even in the hip on that
Yeah,
right side.
and in the glute and the hip, exactly, right? And the good thing is too, it's also going to work on your hip muscles because you have to stabilize your hip as opposed to dropping it, right?
Awesome. Okay, that's great. So what I'm going to do now is I'm going to show you my two favorite exercises to strengthen and stretch your lower back. So on that sheet, you'll see that there's one exercise called the Mad Cat. And again, just like Dr. Peter was in that quadruped position when you're on your hands and knees, this one here is where you're going to hollow the back, and then you're going to be arching the back. Some people also call these humps and hollows because you're starting with hollowing the back, and then there's almost like there's a rope that's on your back that's being pulled up to the ceiling, and you're trying to arch the back up. And you're just holding each position for a couple of seconds and going back and forth between those two positions.
So Dr. Tim, how many of these would the patient want to do?
Great question. I would aim to do like maybe 10 to 20 of these. It's to your tolerance, really. And what you should feel is as you're doing these exercises, if there's some stiffness or soreness, it should start to get a little bit less as you're doing them. If you're doing a stretch or an exercise and the pain gets worse as you do it, then that's something you'll want to discontinue and just wait until you talk to Dr. Peter or myself. So again, that's called a Mad Cat stretch. The other exercise that I want to show you that's a good strengthening exercise, it has to do with what is called planking. And some of you may be aware how to do this, but this is really good to strengthen your core. If you're new to planking, what you want to do is you want to start from your knees and you want to put your elbows on the floor. And all you're trying to do is you're trying to create a straight line between your shoulders and your hips. And you're just trying to hold that position. You don't want to have your bum up in the air. You don't want your hips to be sagging down too low. You want to try to hold your body off the floor in that position. And you want to aim to do it for about 20 to 30 seconds. And as you get good at this, you'll be able to hold it for longer durations. So this is the first position Dr. Peter and I want you to try. And as you get good at this, you'll eventually be able to do it up from your toes as well. And you'll be able to hold that position. Now that's the first position. The other way to plank is from your side. So a side plank looks like this, where you're on an elbow and you're kind of up on your knees, and you're trying to make your body straight, and you're strengthening the muscles on the side of your spine. So you'll obviously do this on the left side as well as the right side. And when you get good at these, you can actually do these from your feet as well. So again, you want to hold that contraction for 20 to 30 seconds. Do it a few times in a row, and increase the time as you get better at that.
You should probably do them in front of a mirror as well. This will kind of give you a feedback if you're in the right position, you're not too high or too low.
That's awesome. So Dr. Peter, did you have any other closing comments? We obviously showed you 2 exercises to stretch and 2 exercises to strengthen your lower back. Anything you want to finish with?
I'd just like to mention that, if you take care of your body, then your body will take care of you. So it's definitely, would be very positive if you incorporate some of these exercises in your program, even if you don't have low back pain, because it's going to help prevent you from having problems in the future.
That's awesome. Thanks so much for watching this. If you have any questions with regard to these exercises, please let Dr. Peter and I know. Have an awesome day.
Bye for now.